All right, so like I said before, thanks again for doing this. I appreciate it. Tell the audience a little bit about yourself and how you got started in the community.
Yeah, well, hello everyone. My name is Diana. I am a licensed clinical social worker supervisor in the state of Texas and in Arkansas. I provide mental health counseling services for clients that are struggling with OCD, anxiety disorders, and trauma. I got started in this field back in 2016, 2017, right before like graduating from college. I entered my master's program in 2016 and got into counseling because of one of my friends in Little Rock, Arkansas, actually. She encouraged me to start looking into social work, and I started looking into social work. I read a book called Crazy by Pete Early and just really enjoyed his writing on the mental health system in America and his struggles with like the mental health system because of his son, and just really, really loved that. And I felt like it was like my calling to go into counseling and do social work.
That's nice. So if I could ask, like, what sorts of things do you do as a psychologist and in your particular role specifically?
Yeah, so as a social worker, I provide counseling services, like I said, for anxiety disorders and OCD and trauma. So as a counselor, I work with these clients that are struggling with intrusive thoughts that lead to compulsions. And so what I do is what we engage in something that's called exposure response prevention, or ERP. And ERP is the gold standard to treat OCD. And I use ERP as well in other areas that are with anxiety disorders. And so I'll use some of that for generalized anxiety, social anxiety, panic disorder, and the phobias, like any types of phobias.
Because that was literally my next question. What methods or approaches do you use in your particular work?
Yeah, so I do exposure response prevention. My clients typically, whenever I talk to them about that gradual exposure work, they get a little nervous, and I can see why they get nervous because it's like it literally having them confront their fears. And I was actually working with a client the other day on a metaphobia, and a metaphobia is the fear of vomiting or vomit. Um, so we started kind of like very small, like gradual exposures on. First, we just started on something very simple as just like me writing the word vomit and the client saying the word vomit, and then trying to do various words that like relate back to vomit. So like vomit, throw up chucking, I'm gonna be sick, and just kind of like saying those out loud and really sitting with some of that anxiety and confronting that.
Yeah. That yeah, that yeah, I'm getting a lot of pictures in my head. Yeah. Yeah.
Yeah.
My next question is, tell me a little bit about, what have your clients said when they approach you? Do they say, Diana, being with you has made me feel so this and make me feel so that? What have the patients said to you, when they come seek for, treatment or whatever they need?
Yeah. So when they're coming to me, they're talking to me about like that they're either really sick and tired of like their compulsions, or they're tired of like doing all these rituals because they're very exhausting or mentally exhausting. And as we're working through, and we start with like mostly when we start, we do a lot of intake work, and then we do psycho ed. And so during psycho ed, whenever I'm kind of reviewing like the OCD cycle with them, or kind of reviewing kind of what's going on with OCD and what's happening in their brain, they usually tell me they feel very validated, or they feel like, oh, that makes sense, or things are starting to click for them. And that makes me so happy because what I want really is for them to kind of understand what's going on, and it's not them, it's their disorder that's causing a lot of these intrusive thoughts.
Mm-hmm. my next question is what impact does doing this type of work as a social worker, have not just on yourself, but also for the greater community? What benefit does that have? It's a two-parter.
Yeah. So I guess like some benefits here is just kind of like a lot of awareness to anxiety disorders and OCD. And bringing a lot of awareness that like OCD is not just kind of like what you see in the movies or kind of what you see on TV shows, because a lot of folks have that stereotype of like, oh, they must be afraid of germs and they like to clean a lot or they're very organized. And it's not really about that. It's really a disorder where there's a lot of ego dystonic thinking where like things are not really aligning with their values or they're not aligning with like their self-image, and so they compulse, and it creates a lot of disturbance or creates a lot of distress. And so kind of bringing some of that awareness, and then two, like learning how to understand that like OCD and anxiety disorders are probably not going to go away. If anything, we're just going to build a lot of the foundational work to be able to get back in control of these like intrusive thoughts, and also creating like skills and abilities and strategies to be able to kind of like get them into remission, those thoughts into remission.
Mm-hmm. My last question to kind of wrap this up is what can people take away from this conversation? How can learning about OCD, how can people sort of be more educated and be more aware of like not just what it is, but how to sort of approach it if a family member has OCD or someone they know has OCD, how can they be sort of more mindful to sort of know what it is, but also the warning signs of, you know, oh, if someone has OCD and how they can approach it.
Right, right. So OCD can come in different varieties of forms of compulsion. So um the most common one would be your stereotype, which would be like the overt behaviors like the hand washing or the light flickering and things like that. And then the harder ones to kind of start to notice is like the reassurance seeking and avoidance behaviors, or mental compulsions can be very difficult to kind of see because they're not usually ones that you can actively see. You just have to kind of be aware of those. And so if you're noticing clients that are having like a lot of avoidance, or a lot of people that are doing a lot of excessive ritualistic behaviors that kind of seem off, or because of a fear base or compulsion base, then like it would be just encouraged for them to go talk to a counselor that, oh, hey, I maybe suspect you may have OCD. Like you can look up IOS at the International OCD Foundation for resources, or looking up a therapist that specializes in anxiety disorders or OCD, because it's going to be very important that they do actively look for somebody that specializes, because traditional talk therapy can be more detrimental.
Mm-hmm. I also noticed that you also have a large social media following and that you're trying to give tips and advice to people, like of what OCD is and how they can sort of cope. But my question on that is, I know that I said this was my last question, but just a bonus question, if you will.
Yeah.
How does like the presence of how does social media help create sort of that reach to that audience of like the people how does it create sort of that reach towards to get people educated and to know about OCD? I know it's kind of a long-winded question, but yeah.
Yeah, well, I guess definitely like making sure that the person that you're following is actually somebody that is an OCD specialist, or is someone who has OCD and is talking from their experience, because there can be a lot of misinformation about OCD and anxiety disorder. So I think it just for sure making sure that like the person that you're following or you're watching is a therapist that specializes in this, or it's somebody that has OCD and has that diagnosis that is coming from experience. And then two, making sure that like when we're looking at things on social media, like, talking to your mental health professional is going to be very important, and not that these are not mental health advice or like any sort of like, because you're not my client and everybody's different. So I want to make sure that these are just fun suggestions on how to kind of tackle some of these things.
Yeah, because I feel like with social media, I was talking to a friend about this the other day, and she said like how on social media there's a lot of hate, there's a lot of sort of bigotry, and that she was talking about how social media could be more mindful, I guess, to people
Mhm.
in with mental health, because Simone Biles 4 years ago talked about her own mental health struggles, and so
Yeah.
yeah,
Yeah, yeah, it's definitely going to be one of those things that just being mindful, like who you're following and making sure that like the person that you are following is just, has experience with it or is a specialist or has that lived in experience. I know I have some clients that come to me with like, a list of stuff and like, hey, I want to address this with you because I saw this on TikTok, and I'm like, let's just talk about it. And I typically welcome it because I want to make sure that like their thoughts and everything is valuable. And then we kind of go through it and then we talk a little bit about like why this is not this or why it's that. And I think that's just important because there's a lot of misinformation too, and not everything applies to you, and not everything is those symptoms, but it is a place always to start. Just like Googling, right? Like Dr. Google is going to be a place to kind of start to look up your symptoms and things like that. But talking to a professional is where you're going to get a verified answer, and advocating for yourself. Of
yeah,
course, like I don't discourage advocating for yourself.
yeah, those two things are important for sure.
Mm-hmm.
It really is.